Have you ever wondered why so many healthcare professionals insist so much on the importance of consuming a fiber-rich diet? While most of us know the connection between fiber and digestive health, did you know that fiber also plays a crucial role in blood sugar control? It's true, and it's an aspect that is often overlooked when discussing the benefits of fiber for health. Think about it for a moment. Why are people with diabetes often advised to choose whole fiber-rich foods instead of processed options? What do fibers actually do in our bodies that makes them so crucial for maintaining blood sugar levels? Let's delve deeper into this often underestimated aspect of nutrition and understand why fibers are so important for blood sugar control. Have you considered how fibers can help prevent spikes in blood sugar after meals? Or how they can impact our insulin sensitivity and, in turn, our risk of developing type 2 diabetes? Let's explore these questions and more, delving into the details of the benefits of fiber for blood sugar control. So, get ready to expand your knowledge about nutrition and discover why fibers are truly a powerful ally in maintaining a healthy life. Here are some of the key benefits of fiber for blood sugar control. 1. Reduction of glucose absorption. Fibers are components of plant foods that are not digested by the human body. There are two main types of fibers, soluble and insoluble. Soluble fibers have the ability to mix with water to form a gel in the digestive tract. This gelation slows gastric emptying and intestinal transit, thereby prolonging the time food remains in the digestive system. When foods rich in soluble fibers are consumed, such as oats, beans, and some fruits, the formed gel delays the absorption of nutrients, including glucose, in the small intestine. This results in a slower release of glucose into the bloodstream, preventing spikes in blood sugar after meals. Consequently, blood sugar levels are more stable and controlled. 2. Improvement of insulin sensitivity. Insulin is a hormone produced by the pancreas that plays a key role in regulating blood sugar levels. Its main function is to facilitate the entry of glucose into the body's cells, where it is used as energy or stored for future use. Insulin sensitivity refers to the ability of the body's cells to respond properly to insulin signals, allowing efficient glucose uptake from the bloodstream. When cells become less sensitive to insulin, as is the case in insulin resistance, glucose remains elevated in the bloodstream, leading to the development of type 2 diabetes. Fibers can improve insulin sensitivity in several ways. Firstly, the slow digestion of fiber-rich foods results in a gradual release of glucose into the bloodstream, reducing the need for large amounts of insulin to control blood sugar levels. Additionally, soluble fibers can form a viscous gel that slows the absorption of nutrients, including glucose, in the small intestine, which may help improve insulin sensitivity in the long term. 3. Promotion of satiety. Fibers have the ability to increase feelings of fullness and satiety after meals. This is because fibers, especially soluble ones, absorb water in the gastrointestinal tract, forming a bulky gel that distends the stomach and sends signals of satiety to the brain. As a result, people who consume a fiber-rich diet tend to feel more satisfied for longer periods, which can help reduce total food intake throughout the day. When it comes to blood sugar control, promoting satiety is important because it helps prevent overeating, especially of simple carbohydrate-rich foods that can lead to spikes in blood sugar. By consuming fiber-rich foods, people are less likely to overeat and more likely to maintain stable blood glucose levels. 4. Prevention of blood sugar spikes. Blood sugar spikes occur when glucose levels in the bloodstream rise rapidly after a meal, especially when consuming foods rich in simple carbohydrates. These blood sugar spikes can be problematic for people with diabetes or insulin resistance, as they can overwhelm the body's glucose regulation system. However, fibers can help prevent blood sugar spikes in several ways. Firstly, as mentioned earlier, soluble fibers delay the absorption of glucose in the small intestine, resulting in a slower release of sugar into the bloodstream. Additionally, insoluble fibers found in whole grains, vegetables, and fruits help to slow gastric emptying, which also contributes to a slower release of glucose into the bloodstream. By avoiding blood sugar spikes, fibers help maintain glucose levels within a range throughout the day. 5. Maintenance of a healthy weight. Obesity and overweight are significant risk factors for the development of type 2 diabetes and insulin resistance. Therefore, maintaining a healthy body weight is crucial for blood sugar control and the prevention of diabetes-related complications. Fibers play an important role in weight management in several ways. Firstly, as mentioned earlier, fibers promote satiety, which can help reduce total calorie intake. Additionally, fiber-rich foods, such as fruits, vegetables, and whole grains, tend to be lower in calories and more nutritious than processed and refined foods. Therefore, by choosing fiber-rich foods, people can reduce total calorie intake without compromising on essential nutrient intake. Furthermore, fibers have a low glycemic index, meaning they cause a gradual and moderate increase in blood sugar levels after meals. This can help prevent excessive fat storage and promote fat burning, aiding in weight loss or the maintenance of a healthy weight. 6. Improvement of intestinal health. Intestinal health plays a crucial role in regulating blood sugar levels. A healthy gut is able to properly absorb nutrients, including glucose, and regulate the body's inflammatory response, both of which affect blood sugar levels. Fibers are known to promote intestinal health in several ways. Firstly, insoluble fibers, such as those found in whole grains, help add bulk to stools, promoting intestinal regularity and preventing constipation. This is important because constipation can negatively affect the absorption of nutrients, including glucose, in the small intestine, potentially resulting in blood sugar spikes. Additionally, soluble fibers serve as a substrate for beneficial bacteria in the gut, promoting a healthy gut microbiome. These bacteria ferment soluble fibers, producing short-chain fatty acids, which have been associated with various health benefits, including reducing inflammation and improving insulin sensitivity. Furthermore, a healthy gut microbiome has been associated with lower blood glucose levels and a lower risk of developing type 2 diabetes. Therefore, by promoting intestinal health, fibers can indirectly influence blood sugar levels, helping to keep them within a healthy range. In conclusion, fibers offer a variety of benefits for blood sugar control, including reducing glucose absorption, improving insulin sensitivity, promoting satiety, preventing blood sugar spikes, maintaining a healthy weight, and improving intestinal health. By incorporating fiber-rich foods, such as fruits, vegetables, legumes, whole grains, and pulses, into a balanced diet, people can help control their blood sugar levels and reduce the risk of developing type 2 diabetes and other health-related complications. Here are some common sources of dietary fiber. Fruits. Fresh and dried fruits are excellent sources of fiber. Fruits such as apples, pears, bananas, strawberries, raspberries, and blackberries are particularly rich in fiber. Remember that consuming fruit with its skin, when appropriate, can significantly increase fiber content. Vegetables. Vegetables such as broccoli, Brussels sprouts, carrots, spinach, kale, and pumpkin are great sources of fiber. Try to include a variety of colorful vegetables in your meals to ensure adequate fiber intake. Legumes, beans, lentils, chickpeas, and peas are some of the best sources of dietary fiber. Additionally, legumes are rich in plant-based proteins, making them a nutritionally dense choice for any diet. Whole grains, foods like oats, quinoa, brown rice, barley, farro, and buckwheat are examples of whole grains that are excellent sources of fiber. Swapping refined products for their whole grain counterparts is an easy way to increase fiber intake. Seeds and nuts, chia seeds, flax seeds, pumpkin seeds, sunflower seeds, and nuts are rich in fiber, as well as healthy fats and other essential nutrients. Add them to smoothies, salads, yogurts, or consume them as a nutritious snack. Whole grain cereals and breads. Choose breakfast cereals and breads made with whole grains to boost your fiber intake. Check food labels and look for products that have at least 3 to 5 grams of fiber per serving. By incorporating a variety of these fiber sources into your daily diet, you can ensure adequate intake of dietary fiber, which is essential for maintaining digestive health, regulating blood sugar levels, and promoting a healthy lifestyle.